just explain some of the barriers and challenges that are associated with dementia real-world studies?
I think there's certainly a trust issue in the community, especially in underrepresented and underserved populations. The history of trust or mistrusting research runs deep in our communities, and there are many examples of that throughout the recent decades in history. I think that's important, a barrier from a community, from a participants level. I don't think as researchers we do as much outreach as we ought to do sometimes to be able to communicate the clear, concise messages of why someone should enroll in research projects. There are also methodological issues in terms of feasibilities and readiness of community to be able to enroll in research studies. There are also linguistic and cultural issues. We can't just simply translate a measure, a cognitive measure from one population to another without understanding the implications of that. Does it actually measure what we intended to measure? Often translations needs to be validated and tested and making sure they're reliable. Those are steps often get short-circuited. And so when we gather data, we're not sure what that means, right? So there's really a multiple levels of barriers in terms of making sure that the inclusiveness, it's not just the count of how many underrepresented minorities enrolled in the studies, but rather the study methodology makes sense.
Mm-hmm.